sorry, this bronzed look is giving. Hi, Joe.
Hi, Joe. Hello. I feel like I need to take care of myself. You always look so good and I just always look so shitty.
You don't look shitty, Trey. You just look natural chic. But I do like that you overlined your lips.
Where is my girl who taught me how to overline it? What's her name again?
Oh gosh, I can't remember. Hi guys. Hi guys. I can't remember.
Oh, I loved her.
Hi Carnival babe.
Hi guys.
Hi. Ooh. Okay. Wow. We are warming up. The hands are back. The hands are back.
I did not even want to drink today, and I was kind of feeling like, you know.
No, this is crazy.
Trying to die out. But then.
Yours tastes good too?
Mine tastes the best. Mine tastes the best.
No, you didn't taste mine.
This is Peach Coddler. Coddler. I guess because it cuddles you. I don't know. This tastes really good. This is
a caramel apple white Russian.
Let me taste that.
Let me taste this. Well, that's some red rum in there. I like that.
Rasta George.
Yes, George is right. George is all the way right.
Sir.
Thanks, guys. Thanks, guys. Wow, these drinks today, shot. Okay. Big up to Lady B Mixology. These two drinks today are amazing.
Yeah, these are definitely encompassing the fall collection.
Yeah. Oh yes. Okay. And I actually, the YouTube video that will be out for me on Friday will be showing you how to on this fall look that I have here, while we sip on some fall drinks.
I know. What is in this Peach Coddler? What liquor is this?
It tastes like red rum.
Jeez, red rum.
Get psycho. Why? Alright guys, so today we have what are those? Okay, so Lady B Mixology, right? She's available throughout Kingston, Butcher's Block, Sovereign North, Cannibal Cafe, and also
Jamaica.
the Commissary, Jamaica Food and Drink Kitchen. So you can go and you can get yourself some Lady B Mixology pouches. Oh, it's white rum, sorry. White rum
in mine.
White rum in hers. And I have a white Russian. So if you're having a party, if you're going on the road, if you're traveling, you're going to Birdbush and you know so the buckle them now work, you can grab yourself a couple pouches, you can freeze them, and yeah, just have them throughout the day.
It's Uptown liqueured bag juice. Okay?
You don't need to say Uptown, it's fancy.
Oh, fancy? I like Uptown better. Makes it sound.
Yes, I wish she could deliver to the US too, because these flavors today are popping.
Yeah, these flavors are really popping.
Alright guys, so we have a lot going on here today in the closet. So, you know, in the closet we have wig, we have water filter, we have makeup, we have all kind of things. And today in the closet we have body health.
You know, it's so funny because I don't think a lot of people know about body health. You know, like everybody knows how to get a dick down, you know, but nobody really knows.
I'm not sure how to ask. Tracy,
nobody knows how to take care of that D.
You don't know that?
How do you know?
Well,
are you taking care of your D?
Yes, I am.
You are. That's good. That's good. That's good.
I am a bodyologist.
You are. Okay. You know, and as women, I feel that it's very important that we encourage our men, you know,
sons, brothers, friends,
to go and check out their body health, because I do think it's something that a lot of men overlook. They overlook their body health, you know. Women are very into their pum health because a lot happens in our pum, and
a lot, I feel like a lot more can happen because it's just kind of closed off in there, you know. So helping us today to explore body health, and also it is Prostate Cancer Awareness Month. We are going to invite on Advanced Urology Kingston and speak to Dr. Gafoor. So let us bring him here into the chat. And we can speak to Dr. Gafoor.
So just to give you a little bit of information about who Dr. Gafoor is before we get into
Hey, there he is. Hi, Doc.
Hi, guys.
Welcome to the show.
So,
Tracy would like to give you a great intro. Go ahead, Tracy.
Wait, hold on. I have to find it.
She lost the intro.
No, I did not.
She practiced it twice.
Because there's a lot of words in there that I could not really read. It was like so hard, actually.
All right.
So, Dr. Gafoor is a urologist who is dedicated to benign and malignant diseases and specialized with specialized expertise in minimally invasive surgery, urinary stone disease, and renal transplantation. Presently, he's a consultant surgeon with a private practice. He also is employed to the Kingston Public Hospital. He graduated the University of West Indies, Mona, where he attended medical school MBBS 2001 and further specialized in urology, doctorate of medicine. He attended McMaster University and the University of Toronto for elective training during his residency. Dr. Gafoor then specialized with fellowship training in minimally invasive surgery, urology, and stone disease, as well as received an honorary appointment in renal transplant surgery at Monash Health Services in Melbourne, Australia.
Wow.
Like, Doc, this is a lot.
Doc, yeah, but
that's a lot. I don't know if I said half of those things correctly.
Welcome, Dr. Gafoor, to Tuesdays with Tricky, where we're going to take everybody's mind off of what's going on outside the closet as we bring Dr. Gafoor inside the closet as we explore Prostate Cancer Awareness Month. Doc, welcome to the show.
Thank you, guys. Thank you, Tracy. Thank you.
So before we start, my lady viewers are very rude, right? So we're just going to get this out of the way. Doc is married, so let us get down to business. No, you know, it was a couple of years ago that I found about the name urologist, because all this time I thought it was a bodyologist. Mm-hmm. What exactly does a urologist do?
So urology is a surgical science of the urinary and genital system. Mm-hmm. So male and female. It involves the kidney health, not the medical part of it, but the surgical. So if you have a stone or you've got a growth in your kidney or a blood obstruction, the bladder, so bladder issues, trouble holding your urine, or or bladder cancers, prostate issues, enlarged prostate as well as cancers, and yes, some penile issues as well.
Somebody calling, Doc. Don't worry, that happens to me all the time. So can you take a child to the urologist?
There absolutely are pediatric urological issues.
Yeah.
A lot of kids are diagnosed more in utero with urological issues, blocked kidneys, and some of these can even be treated in utero before the baby's born. But that's a different subspecialty of urology, and my hats off to those guys. They do really well.
Okay. So September is Prostate Cancer Awareness Month, and I have to say, I'm not afraid to sound stupid. I did not know where the prostate was until we were coming to do this show. I thought the prostate was the balls.
No, the prostate is like behind the balls. It's like a piece of the penis, but traveling up towards the anus.
Now, tell us what the prostate is.
Yeah. So the prostate is at the base of the bladder. It is, and that starts at the beginning. It's an accessory sex organ, which means it's not the penis. It's not essential, but it is accessory to the reproductive health. It helps them to stay fluid and liquid. It produces some enzymes and some as they're ejaculated. So you can do without it.
Right.
It's the pelvis in the lower tummy, or the bladder in the man, and the urethra, that's the urine pipe that leads from the bladder to the penis on the outside, goes through it. So as it gets larger with age, it can compress the passageway and obstruct the flow of urine, and that's really a benign, non-cancerous condition. And so develop cancer, which can metastasize or spread beyond the prostate and affect the entire human being. It can spread to the spine, to the brain, to the lungs, and cause a lot of problems.
So the prostate is like a little pocket that can be removed?
Yeah, it's about a walnut-sized organ. Normally, it can go to be very, maybe 10, 20 times that size.
Right.
But you access it, you can feel it through the rectum. So with a finger in the rectum, you can palpate it. It's actually been called the male G-spot, if you want to call it that. So you can access it through the rectum.
Right.
It lies a little in the...
So can you do a self-check on that if you know what you're feeling for? Or you don't suggest?
You you're very, dexterous, it might be.
Flexibility level 100.
So I find that this is where we hear about the prostate, because we hear about this dreaded test and man no want do that and really. But this is why the levels of prostate cancer in Jamaica are so high, because the ignorance with the test and that.
Actually, prostate cancer is the number one cancer
in Jamaica. Yeah, because of the ignorance of getting tested, the finger up the butt, which I find that finger up the butt is really the biggest deal. But is there another way to test?
So screening, which is the detection of disease before it becomes symptomatic, which is what we're talking about. Unfortunately, prostate cancer doesn't have a lot of symptoms, and so by the time you have symptoms, it's usually too late. You have spread to the bone and you have severe bone pain. It's too late to cure you, and we're just talking about treatment. So screening is the detection of cancer maybe 10 years before it becomes lethal. And so that involves two things: a blood test and the prostate exam or the rectal exam. Everybody's done a blood test, so that's not really the barrier. We do have significant cultural barriers in Jamaica to men feel like it's going to affect their sexuality. One where if you have a rectal exam, some men are afraid it's painful. I can assure you, I have never had a patient who came to me afterwards and said, I really regret having my prostate checked.
Right.
I was straight and now I'm gay, or I was gay and now I'm
right.
It's never happened.
Right.
The discomfort, it can be available for some.
Right.
Pain, rarely, unless you have a major the prostate, in which case you probably can wait until that infection resolves to get it examined. But it's literally a 5 to 8 second procedure. Some people, most men will tell me when I'm done, Doctor,
that's it?
Yeah.
Because I guarantee you, most of those men have had a finger in the butt before, Doc. Come on, man.
What are you going on with?
So my other question is,
Sorry.
So my other question is,
wait, hold on.
Repeat?
Doing mammograms for decades.
Okay, so this is my next point.
And it lasts longer than a prostate exam. So I think it's time for men to step to their part in making sure their families are safe and they're taking care of themselves.
Yeah. So for a woman, it's said there's a certain age where you should start doing a mammogram. Is there a certain age where men should start getting their prostate checked?
In Jamaica, the Jamaican Urological Society recommends you start at 45.
I think that's late.
In countries where it's not as prevalent, okay? You can start at 50. If you're Caucasian and you live in a country where the incidence is low.
Yeah.
But if you're Jamaican and you're of black descent, already at high risk, and we start at 45. If you have had someone in your family who's had prostate cancer, you should start at 45.
Okay.
If you have a genetic test, you have a high-risk genetic predisposition, you should start at 40. Right?
So when should you start doing the blood test to check before you do the actual physical test? When do you do the blood test?
Yeah, so you can do a blood test at 45 at your
Okay.
GPs. If prostate exam is a barrier to you getting screened, I would say just do the PSA. It's not ideal because sometimes the blood test, the PSA, which detects cancer early, it may be normal, but on the rectal exam, detect something. Maybe once every 10 cases, you have a normal blood test and an abnormal exam. So the two things go hand in hand. But I would say if it's a major obstruction, do the blood test, and if it's abnormal, then your GP will send you on to a urologist who will then talk to you about examining the prostate, and then you can move on from there.
Right.
Are there any other contributing factors to this disease other than hereditary?
Yeah, it's what you call a non-modifiable risk factor cancer. So the things that you and drink don't really affect it. There are three things that put you at risk for developing a prostate cancer. Number one, your age. So the older you are, the higher the risk. And at about 65 is when there's a peak in incidence or new cases. But it's early as 45, 50, and very uncommon. Number two, your race as we said before, if you're black, all right? If you're from a Scandinavian country. Number 3, your genetics. You've got in your family who's had prostate cancer. You're 3 times the risk. And if you've got more than one person who had prostate cancer, especially if they've been young at diagnosis or they died from it, you're at 7 times the risk. The average risk of prostate cancer in Jamaica, 78 per 100,000, which is one of the highest rates in the world. So it's very common here. As you said before, the most common cancer in Jamaica, the most common cause of cancer-related death in Jamaica. And that's very similar to numbers you see in the States. So that's reproducible. Cancer, prostate cancer is common and is lethal, and we see it throughout the world. But in Jamaica, it's very common. And if your risk is 78,000, without any history, family history, it's 7 times that if you have a family history.
Wow,
so really,
is a lot. That's a lot.
Know anyone in your family has had it.
So
that would translate to 2,300 new cases in Jamaica every year alone. And your lifetime risk is 1 in 8. 1 in 8 men in their lifetime would be diagnosed with a prostate cancer. Luckily, not all of them, most of them are not lethal, but you wouldn't know if you don't get it checked, get it graded, staged, and determine what your risk is.
So, okay. So much knowledge a while ago into the reasons why we need to go and get tested, but let's just have a little scenario here. Unfortunately, we've gone to get tested and we now have tested positive for prostate cancer. Are there different stages of prostate cancer, like stage 1, stage 2, stage 3, stage 4? And how are we going to treat the different stages? And do we have treatment for those different stages here in Jamaica? A 3-part question.
Yeah, everything is available. The first decision point, I'm not going to bore you with the specifics of stage 1, 2, 3. The first criteria is to determine, is it curable or not? And that all comes down to, is it confined to the prostate or gone outside of the prostate?
Right.
And always know that on the tests that we have, because we're talking about microscopic disease. It's too small for the eye, it may be too small for CTs or X-rays or ultrasounds, and you wouldn't know until it presents itself years down the line. All right, this cancer was already metastatic at the time of diagnosis. So that's the first thing to determine, is it curable or not? And then the treatment is based on, is it curable or not? Majority of cases, or a large number of cases that we're detecting now because of screening. So let me take you back a bit. 20 years ago, the majority of cases that we were detecting were metastatic. Men who had advanced cancer, nothing you could do for them. Give them some analgesics and make their life comfortable. Because of screening, we're detecting cancers 10 years ahead of that stage where it becomes metastatic. So the majority of men are curable, and of those men, a large number don't need to be treated. So there are really 3 kinds of curable of cancer, prostate cancer. The kind that you can live with, and you can observe it, and you'll probably die with it and not from it, and you never need to treat it. Okay. Or a quarter of men who are diagnosed with low-risk disease, only a quarter will go on to need treatment. So 3 out of 4, you never have to do anything about. The rest of those men with curable disease, if it's picked up early enough, the cure rate is as much as 90%. So between 65, if it's very, and 90% of men would have a cure if they had curable disease by one of a few modalities of treatment. One is surgery, the removal of the entire prostate. Number 2, radiation. So you burn it out with, be it from externally or internally. And now we're treating the prostate. If you just have 1 or 2 small foci or areas in the prostate that have been detected to have cancer, you can freeze that, right? And then watch the rest of the prostate gland. That's experimental and maybe a little bit controversial because the entire gland is at risk for developing cancer. So it's one part. you may develop a cancer in another part down the road. But it's an attempt to decrease the morbidity or the complications from surgery and radiation. Now, if you have incurable cancer, unfortunately, surgery and radiation are not going to help. Maybe to alleviate some symptoms with radiation, but you're now talking about hormonal treatment. Increase the testosterone that drives the cancer, so you can get an injection every 3 months, and eventually figures a way around that within 2 or 3 years, and then you may need chemotherapy. Or every year we're getting more and more armaments or bullets to fight incurable cancer. So it's an exciting thing, but you don't want to be in that category. You really want to be someone who, if you have a cancer, it's detected early and it's curable.
So, a lot of men, I think, will say that... Sorry, I have a frog in my throat.
We realized.
A lot of men will say that they don't even want to come and get tested for prostate cancer because if they know maybe they won't have the potential to get an erection, or it going to trouble them in the bedroom, or all of this, when they remove their prostate they're not gonna be able to have the stamina anymore. Is that true? Will removing your prostate affect you
sexually?
Sex drive? Yeah.
Very fair question. Unfortunately, there is a risk after surgery that you can have erectile dysfunction. Maybe 1 in 3 men, depending on the advanced stage of the cancer, how aggressive it is, and the surgeon's experience as well, and what the shape of your prostate is. A lot of things going into it. On average, between 30 and 40% of men can have erection problems after surgery. And that number goes up if you already have erection problems. So it's not going to make it better, but we try to make it worse. There is treatment after if you're one of those unlucky men who do have erection problems. And yeah, it is a concern for men. But you will find that as men get older, and a very subset of men, their priority is no longer erection, especially 65, 70, a lot of men, they want to be around for their family, grandchildren, for their other purpose in life, and whatever it is that drives them. And erections are lesser, importance. So for those men, it's not that big a deal. The cure rate is more important. For those men who do suffer from it and who do want to have erections, then there's medication. We can offer pump. There are injectables and implants put in this, and you can pump up your erection, right? So there are always ways to treat it.
Pump.
But what you cannot treat, what you cannot, pumps, what you cannot treat is cancer. You can treat it, but you can't cure it. So for me, I think having seen people suffer from advanced disease, so people in pain that painkillers can't treat. You're on pep and you're balling, you're blocked and you're dying of kidney failure. You have blood in the urine, blood in the sperm. Hospital having surgeries to stop bleeding. You can't walk. Suddenly wake up and the spread to the spinal cord is knocked out, signal to your legs, and you can't walk, and you'll never walk again. You're no use to your family. You're no use to yourself.
Wow.
That really is worse to me than
Yeah.
the risk of your function. That is potentially.
So let me ask you this now, Doc. So we've been diagnosed, we're going to have the surgery, and we're going to remove our prostate, right? I am so happy to know that we're not actually removing the whole ball sack.
No, but the ball sack is different.
But that's what I thought initially.
So you thought some people are walking out with just a body and no ball sack?
Yes, I did. Yes,
Okay,
I did.
cool.
I did.
Okay.
So I look at Doc's face. Doc is like, what is wrong with you? But I'm glad to know that. Pardon?
In fairness to you, we used to remove the testes for incurable cancer.
Oh.
To cut, but we don't do that much anymore. It's mostly medication, injection, hormones for incurable. But yeah, the surgery to cure prostate cancer doesn't involve the testes, no.
So where do you actually do the incision? Like, where will you do the incision to reach the prostate? Will it be through the tummy? Do you open up the tummy like that?
Laparoscopic.
tummy below the belly button.
Okay.
We can do cross like the C-section scar.
Okay.
Or you can go on, maybe no bigger than my fist.
Right.
If you do it by surgery. That's open surgery. It can be done robotically, which is available in Jamaica. That would be about 6 small cuts like this. When you add them up, it's the same as the one larger cut. And that's an internal surgery. Or you can do it laparoscopically, which is similar to the robotic, but probably a lot more technically challenging for the surgeon. I know a lot of people who are doing laparoscopic surgery right now for prostate cancer.
So which one do you do, Doc?
I've been trained to do open surgery. I don't think, because of the cost of it, that we would be doing robotic surgery in Jamaica anytime soon. It's extremely expensive. If you want to do robotic surgery, I think it's a good idea, good for you. But the results are essentially the same. Whatever you decide to do, whether it be open, laparoscopic, robotic, the 3 things we look at: cancer cure rate, your erection preservation, and the ability to control your urine is pretty much the same for those 3 ways. Well, however you want to do it, the cure rate is the same, the chance of saving your erection is roughly the same, and the ability to hold up your urine roughly the same. Some things will change, like with robotics, you go home the day after surgery. With surgery, you stay maybe 2 days, 3 days. The risk of being transfused blood is lower with robotic than with open. So secondary outcomes differ between one and the other. Cost goes up a lot with robotic, but the main things, it doesn't matter, just so long as you access that care that's available to you.
But this is so amazing to know, Doc, that this care, treatments, testing is available right here in Jamaica. Especially, it's very comforting. I mean,
and to know that we have
one of the best,
world-renowned doctors.
Big up yourself, Doc.
Yeah. But I mean, I was just having a light conversation with Doc yesterday, and I said, in a couple shows ago, somebody had mentioned that, there's such a brain drain of doctors and stuff, and Doc said to me, because we have amazing doctors who have been trained great in Jamaica, amazing nurses. That's why Toronto comes and swoops them up. That's why UK comes and swoops them up, because our doctors and nurses are so well trained. And here is Doc. He's been to Toronto, he's been to Australia, he's head honcho, has an alphabet behind his name,
one whole alphabet,
and he has decided to stay here in Jamaica to help men's health, prostate health, and urology, and all of these kind of things. So just want to comfort everybody out there.
Yes, because Fitz is a little frightened, but Fitz, you need to check out your prostate. I think everybody needs to just be aware. So if you're not in the age category where you're starting to, get those checks and get those screenings, just be aware, be aware.
For your dad, or be aware for your older brother. But Doc, so when we're starting to do these screenings and things, is this something that we can just do with our regular GP, or is this something that we have to make special appointments with a urologist for?
No, the blood test is readily accessible. It costs $1,000 in the private care system. You go to any private lab and get your
$1,000 Jamaican for the test?
Jamaica, it's just a blood test.
Wow.
It's like any test. It's free in the public care systems. If you go to one of the public health institutions, it's free. The consult for the doctor is free in the public system.
Yeah.
Or you pay, whatever your GP would charge.
Right.
It's just a consult, and they do the blood test, and then between you and your doctor, you decide do you want to do the rectal exam or not. And if it's abnormal, though, you will be sent to see a urologist. Okay. And at that point now, you start talking about how do we confirm the cancer. So the PSA, the blood test, and the rectal exam, they're kind of like the alarm, the smoke alarm in your house.
Yeah.
It tells there's smoke, but it may not really be a fire. It could just be someone, left the pot burning. It may not be a fire. It tells you need to look further.
Yeah.
Okay.
And further, so if those tests are abnormal, your urologist may advise that you undergo a test called a biopsy. biopsy to confirm the cancer. That's the only thing that will confirm it, is to into the prostate and take out a couple of bits of it and send it to the lab, look at it and see, yes, there's cancer, no, there's no cancer. Kind of like how a woman would do a biopsy of a breast lump, a fine needle, same thing. Yeah, it's not a painful procedure. It takes about 15 minutes to get a local anesthesia, just like when you go to the dentist and you get a local and you do a filling, you don't feel anything. And that's the confirmatory test for prostate cancer, which would be done by a urologist or a radiologist.
So now that we are familiar with you, Dr. Gafoor, and we have made a connection with you, and our viewers out there, we're friends with you now, where can we find you? Because, you know, if any of us have to find a urologist, where can we find you? Where are you located?
So my offices are at 10 Ripon Road at the Art of Surgery, which is a hospital. My office number is 960-8112. That's 960-8112 at Art of Surgery, 10 Ripon Road.
That's where I did my surgery. Yes. Okay. So I did my yes, I did my surgery to repair my diastasis. So just to get let me see if I understand. So Fitz was asking in the comments, and I noticed Fitz has been gone for many weeks. Welcome back, Fitz.
Welcome back, Fitz, to our show just for you.
Fitz is asking, like, similar to how a woman can do an at-home breast exam, if you can check for prostate cancer at home. And the thing is that, Fitz, you would have to kind of know what to feel for, where to feel for it. So you could get one of these. This is what I got for Tracy when she was pregnant. It's an endoscope, right, Doc? This is how we're going to do an at-home one? No. So I searched for termites, and I wanted to look for Stevie earlier on in Stevie's life. So I would shove this up Tracy's poop. She never did.
She never did.
So I'm going to assist Sean later to see what we can see. And then I can see right on the screen. So Fitz, if you want, I can check you too, okay?
Gross.
To allow you to do that,
okay, so other than prostate cancer, which is super important to be aware of that, what else can we go to a urologist for? Do we have kidney stones that are in the urinary tract? So, boy, there's a lot going on for the men today.
But other urologists, you see women as well. So you, Dr. Ray, have specialized in prostate cancer and doing all of that. But a urologist can see women as well. So even if I have kidney stones as a woman, I would come to you as a urologist as well, wouldn't I?
That's who you would see. You would see a urologist if you have kidneys. Kidney stones can be one of the most painful experiences known to man. I have women, female patients who had children, and they say the kidney stone was worse.
Oh my gosh.
Labor pain. And that's a common thing I hear. It can be bad. It can block the kidney.
So it's a calcium buildup?
Yeah, most stones are calcium, not all.
Yeah.
Different chemical constituents. But if it blocks the kidney, you can lose the kidney. And if you have an infection, you can actually form emboli, so little bits of germs break off, go in and block your fingertips, your legs. You can develop amputations. You can develop sepsis. You can die from kidney stones that become infected.
Wow. What's the largest kidney stone you've seen?
Big. 5 centimeters, 6 centimeters. You know.
Wow. And you pass these through your urine tract? What if you have to get a surgery to get it removed, like it's not budging?
Yeah, so the big ones, we make a very small, almost like a laparoscopic hole, but a lot smaller, and go into the kidney and break it up in the kidney. So I don't do open surgery for stones. It's all endoscopic.
Okay.
And lasers and probes and ultrasounds and cool stuff like that. But so we go into the kidney, either through the urethra, through the opening that you pee out of, or through a small cup in the side. And the recovery is fairly quick usually. If it's all in, you can go home the same day.
Okay.
If it's through the kidney, you usually go home within a day or two. That's fun. That's the fun stuff that I do.
It's so interesting to me that you were in high school and you said to your brethren, yo, I'm going to be a doctor. And then you went to medical school and everybody has to do the regular doctor program. But while you were in the doctor program, you were like,
I'm going to take it further.
Yeah, and I want to be a urologist. And that to me is something that not a lot of people travel along that path? You know, how did you even decide that this was what you wanted to do? Did you have like a family member who suffered from this, or like why was it something that even popped up, you know?
I went to university, wanted to do something completely different. I wanted to be an engineer, but it was too hard. I ended up doing urology because it's really exciting for me to work with the technology that we have available today. So, you know, what people, if you would have gotten a cut this big for your kidney stone in the past, they would have opened your kidney, it would have bled, you may not get all the stone out. Same thing for the prostate, you know, the bleeding would be heavy, the recovery is long, but the techniques and technology has really minimized the complication rates or knowledge of the anatomy, and you know, it's made it a lot easier to access healthcare for patients. And instead of having a cut this big and being laid up for 6 weeks where they cut through your muscle, and you wouldn't C-section knows what that's like, right? Now you can go back within a day or two and back to work by the next week, back next day, depending on what's done. And so, you know, working with robots, working with cameras and endoscopes and lasers is what attracted me, number one. That's a selfish reason. I get to have a lot of fun. But when I see how prevalent urological diseases are, how many different urological diseases are, that's what really interested me. That so many men have prostate cancer, so many people have kidneys, so many people suffer from urinary incontinence. So how many women have had 2 or 3 kids, and maybe after the first one, you cough or you sneeze, but you have a urinary accident. Many women think you have to
That's not true. So that is something that I wanted to talk to you about as well. Let's just touch on this really quickly, because so much to talk to you about, Dr. Gafoor. I mean, such a plethora of knowledge that you have over here of things I don't think that are spoken about very often. Is that women do have, it's called incontinence problems, right? When you sneeze after, you know, your pum pum walnut tight again. You know?
Your pum pum walnut tight again.
Mine is good to
Your
go.
Your pum pum walnut tight.
How you know?
I have the Great Wall of China over here.
But you also fix those problems as well as a urologist. Like, you know, I don't have to deal with sneeze and wee-wee anymore, or having to wear constant pads every day because I'm having little
wee-wees.
Little puddles. So that is something that you as a urologist deal with as well.
That's also in the scope of the urologist. It's unfortunate that women think that they have to live with it. It's just part of mother, and you know, that's just what we've come to accept. It's not true. You don't have to suffer in silence. It is a very small 20-minute procedure that you can do.
A 20-minute procedure? It's like a lunchtime procedure. That's it. Simple as that.
So hold on. Does it stop you from peeing, or does it make your whole pum pum tight?
No, it just stops the urine, unfortunately.
Oh.
We put a little hammock or a little mesh in it. It holds the urethra. It restores your control of your urine.
Okay. Wow, Doc, we have learned so much.
So we're going to put your information, Doc, right in the description in case anybody wants to get through to, anybody wants to check, anybody wants some more information. And guys, the IG page is Advanced Urology Kingston, right? All right. Does anybody else have any more questions for Doc? What is the procedure called where you put the hammock in the pum pum?
It's a sling procedure. There are different names for it.
Right.
Whether it's very small, whether you have an exit cut, it basically
depends.
Boils down to a urethral sling procedure or a mesh procedure.
Okay.
Yeah.
All right.
Yeah.
Do you do tummy tucks? Fitz, what?
No, I don't do tummy tucks.
Why do I have to read Fitz's questions of
all?
Jeez, man. Doc, everybody is saying not only do you look like Levi, but you're really, really informative. So we just want to thank you so much for passing by. Does anybody else have any more questions for Dr. Gafoor? You know, they're saying thank you.
So, and you don't get them answered here right now on the Tuesdays with the Tricky Show, you can always DM him at Advanced Urology Kingston. And that is the page for Dr. Gafoor for his Art of Surgery. And wow, I'm just blown away that it's not in the balls.
It's not in the balls tree.
Wow, we learn something new
every day. You learn something new every day.
Every day.
Dr. Gafoor, thank you so much for joining us here on Tuesdays with Tricky, and we look forward to having you again soon. Maybe we could even watch it on a procedure while, I know Tracy would enjoy that.
Thank you guys. Thanks for the great you're doing in spreading the very important prostate cancer awareness month. Thank you.
Yes, Doc. Appreciate it.
I want to emphasize before I go, which is, I think that you're the persons who are looking at this, the mothers, the sisters, the girlfriends, the wives, the aunties, you're the ones who so many times you get men in, you say, you know what, it's been too long. You're not getting away with it this year. You need to get your prostate checked. Women are the ones who've been doing mammograms for decades.
Yeah.
And the time men step up and do their part.
Yes.
Yeah.
So many of my patients tell me, my wife said I need to come in, and that's why I'm here.
Yeah.
Okay. Yes, we're going to encourage everybody, especially during September.
Be the nag that you are, women. Be the nag that you are.
For September Prostate Cancer Awareness Month. Doc, thank you so very much, and we look forward to having you on the show again soon.
Thank you.
All right.
Bye. Wow.
All right, guys, a lot going on there with Dr. Gafoor, and so we just wanted to encourage all of our guys right here on Tuesdays with Tricky to get yourself checked, get a screen,
and since you guys have the knowledge right now, I feel very, very privileged to be in the position to get this information straight from such a renowned doctor. Like, geez, could he have any more alphabets behind his name?
Yeah, so we have such an amazing doctor in Jamaica that should you ever need to do any form of treatment, he's right here in Jamaica. And this is so awesome to know that, although we are experiencing a lot of brain drain, that we have a whole heap of brains still left here. So guys, we do want to encourage you, Fitz want to encourage you just to get yourself checked out, because prevention is better than cure, and we do want to have you guys here for longer.
I also want to introduce you to...
Yes, guys, I saw the comments about Levi, but I kind of think they were a little disrespectful, so I'm just going to brush over them. So
I'm just going to talk to you guys right now about this flavor combo that I have.
Oh gosh, what we have from Candy Craze. How come the cup is pink?
What?
The cup is pink, the cup is usually blue. What you have?
Pistachio and Reese's cup.
Okay. Today I have coffee and...
Who comes up with these flavor combos at Candy Craze? Because honestly, I would have never, ever, ever put this together.
Oh gosh, coffee. I haven't had coffee ice cream in so long. I'm going to save this for later. I started watching Echo with Sean.
Oh my gosh. Isn't it so crazy? Have you guys started watching Echo? It's on Netflix. And
so
it's
good. Coffee and
it's
cheese
like,
cake.
honestly, the craziest. But it's the last episode of The Bachelorette tonight. All of my bachelorettes.
Do you think the bachelor gets a prostate check before he goes on the show?
Probably not, but because they're so young, they don't get a prostate check. They probably get an STD check though. I think you have to get an STD check and a corona check before you go on the show.
Oh, this is so good.
Okay, so I have some questions to ask.
Right.
And you guys have been very, very live today in the comments. I'm so happy about that, because this question I need a lot of answers for. I was watching TV the other day, and this show came up. This ad for something came up in the middle of it. It was these people that were talking about dating outside of your race, and they were talking about it, and it was a problem for them dating outside of their race. And I was like, what race am I? I was like,
you dated all the other races.
Like, when I went to Barcelona, I looked so, like, I fit right in. Like, I identify in large groups. I identify as black, but I look white. Like,
and then you have colored eyes.
And then I have green eyes. So how, like...
Well, I guess somebody who would say that would be like a one race. Like, so somebody who says I don't date out of my race would either be like somebody who is straight black who says I don't want to date outside of my race. But you can't say that, because what is your race?
I don't know.
Because you're kind of like so mixed up.
I know.
We don't have no race in the Caribbean.
Human race. Somebody says
Human
somebody
race.
says you're just a human race.
Maybe it would be outside of your culture. Yeah, so the better you say I don't date outside of my culture, but
yeah.
Yeah.
I'd better say don't date outside of my culture because I was kind of like, I don't know. I mean, I don't know, and I don't know if people who don't look like me in terms of like mongrel, you know,
mixed. Not mongrel, mixed. You're not dogs.
Excuse me, mongrels got visas to Canada. So I'm a proud mongrel. We get things. Mongrel get things. So, you know, I don't think people who look mixed like me understand how it feels to be mixed, to be excluded from so many conversations just because I don't have a particular
Or you don't
look.
have one. Oh.
Do you understand what I'm saying? And I think there's a lot of...
So you may say that, but I think that, so you as, let's say a mixed person will say, I'm left out of a lot of different conversations. But then also a black person could look and say, boy, I am left out of a lot of different
But
conversations.
there's no mongrel conversations out there. There's tons of...
There are terriers.
Terrier. There's tons of terrier conversations. You know, there's tons of terrier conversations out there. No, there's not tons of mixed people conversations out there, but there's tons of conversations out there having to deal with one specific race. Do you get what I'm saying? So that to me, when people were in that platform and saying, oh, I don't want to date outside of my race, I was kind of like,
well, I don't know. I just feel like if you're dating, like as we were talking last week about love is love. Like when I was dating, I didn't really look, of course I had my preference. I definitely had my preferences, but I didn't go into it and say, oh, I am not dating a black man, I am not dating a white man, I am not dating an Indian man. Like I didn't do that. I kind of more gauged it off of personality and looks, you know, like, is this guy a good looking guy? All right, let me talk to him. But it wasn't like I was saying to myself, I'm not going to date this particular guy, you know, or this particular look. So I kind of went off of like, you know, looks are what first attract me to be like, oh, he's cute. And then talk to him and his personality. But then I wouldn't be like, oh, he's cute, but he's Chinese, you know. I would just kind of open it out to everybody.
Do you guys want to know something that I'm really proud of? Because I don't think a lot of people have, a lot of Jamaican girls have done this. Well, you haven't.
What?
I kissed a Japanese guy.
Oh. Yeah,
He's Japanese. Like full Japanese.
Full Japanese?
Like I probably have
Whoa, Trey.
Yeah. Mariah Carey tour.
Tracy, you kissed the dancer?
Yeah, I did.
Oh my gosh.
He was cute. He could dance.
I think as Jamaicans we learned to just like people, period. It's in your heart. Oh, I'm getting a text message. Someone saying great show. Just the awareness of the urinary tract and prostate cancer.
Kiki says, when you find the person who makes you happy, who cares what they are? Kiki, let me tell you something. So, I want to address this because my girlfriend called me yesterday, elated, because she went on a date with this guy, and it's the first time she's called me being so, like, over the moon about somebody, and she's been on many dates, and I was just like, yo, you know when you know, right? You know when you know. Like, you just get this feeling inside of you. Like, I remember when I met Scott, and I just, like, I couldn't even talk. I was actually out with my girl.
I definitely don't say you know when you know. Because I met Sean, and me and Carla were, and Carla's like, you like him, don't you? And I was like, no, I don't see myself kissing him. Okay, 2 kids later, house, car, and land. Like...
Yeah, but Jodi, I just find that you're so emotionless.
But I did say, I was like, yeah, he's cute, but he's just a friend. Like, I can't see myself kissing him.
Again?
I'm trying to save mine.
I finished mine.
Oh my gosh. And so I'm having the milky drink, the milky ice cream, and my stomach has been so unsettled. Like, Tracy was laughing at me. I've been having a little bit of toots.
Yo, the pistachio and Reese's Cup flavor, it lick off though. This is the
okay,
best.
so I must say, when they mix a pistachio with something else, it's really good. But I don't know if I can do pistachio by itself. And I noticed you didn't offer me any either.
Would you like to?
Alright guys, so today we are having ice cream, very creamy, lovely ice cream from Candy Craze.
Best ice cream in town.
We're having mixed flavors. So we're doing, but I'm doing the coffee with cheesecake, and Tracy's doing the pistachio with Reese's Pieces.
And this is the best. This is the best. What was my combination conversation last week again, and that was the best.
I think you had pistachio with something else too.
No, maybe it was the same thing, but it was so good.
It was pistachio with
something.
something.
Oh, it's
really
cheesecake. It was. Oops, sorry.
You just burped right in my face, and Davina just joined us with her ladylike self, and you're there. Davina, welcome to the show. Always so graceful, just blessing up my timeline over on Instagram.
Davina, we had a urologist, aka a bodyologist, on the show today, and we were talking about prostate cancer in Jamaica, because Jamaica has one of the highest counts of prostate cancer in the world.
2,300 cases a year. One out of every 8 men will have a brush with prostate cancer, whether it be treatable, incurable, or are we still there? Okay, a little power cut. Treatable, incurable, or prostate needs to be removed. There was 3 types.
It was a really
interesting show. So we're just encouraging all of our sons, our cousins, our brothers, our dads, our husbands, our boyfriends, our other boyfriends to just get tested, to be aware, you know. And there's,
how many boyfriends do you have?
I don't know, I want it to be inclusive. And it's not just the physical test that you need to do. You can also test your prostate levels with a blood test that's very inexpensive.
$1,000 Jamaican dollars, and it can be done through the public.
You can go and check my good friend them down at Mana Center. They do blood tests there, but you're gonna need to get a prerequisite from your doctor. But you can do your blood work over at Mana Center, Healthcare Center. The nurse there is the best. I don't cry any at all, even though I give a whole heap of trouble. I don't move, and I have collapsing veins, and she is one of the best. I love her.
Boy,
sorry
I was trying to save some of this for my husband Scott, but Scott,
okay, because you didn't have to mention his name. We know your husband Scott.
Oh. You know him? How you know him? How you know? Oh, you know my husband Scott.
Guys, my tummy has been so uneasy. I'm packing now to go to packing going on back there. Packing to go to Miami for Road Ready. Miami Carnival is coming up in 2 weeks, and I'll be super busy. And then I have a surprise for the kids that I have not told them yet. We are going on a little trip for Heroes Break. I'm not ready to disclose what that is yet, but it's super exciting. But by the time I come back from Miami Carnival, I have 2 days here, and then I leave with the kids. So I've just been packing, and I don't know if you guys know anything about me, but packing just makes me feel like, I just feel like so, I don't know the feeling, like honestly, ooh, Lord of mercy.
Anyway, I had some other topics I want to talk about.
Not The Bachelor.
Okay. What is a deal breaker for you in a relationship? Like
stinking mouth, stinking mouth, stinking mouth, stinking dirty throat back, smell like doo-doo. No, stinking mouth, can't talk to you. You could have cute and rich like, can't talk to you, cannot speak to you. No. And this is a problem, because during the pandemic, all of the man them have a mask, them take it off this year now and thinking mouth. I don't want a thinking mouth, man. Don't want any thinking mouth, man. I don't want hi, and I smell toes, cheese, bacteria, fungus. No, thinking mouth, man. No, done.
So okay. So we know how you feel about that. We know how you feel about that.
You? How about you?
Wow. Wow, we know how you feel about that.
Oh, it's such a turn off.
It is a turn off. It is a turn off.
So you brought up the topic. I mean,
well, I don't have to get over stinking mouth.
No, thinking.
Thinking. I couldn't deal with a guy who had a lot of other ladies. Like a lot of lady friends, or had another girlfriend, or I have a matey. Like that's just something that I wouldn't be able to deal with.
Somebody said bad hygiene. Oh, hair game on point. So can you imagine? So sorry guys, I'm having a little power outage today. So I don't know if you heard. Tracy asked, what is a deal breaker in a relationship, and I said stinking mouth. Somebody was saying bad hygiene, and Tracy was saying like cheating. But can you imagine you have a man with cheats and his mouth stink?
I mean, and you've been putting up with a lot.
No, sir. No. and bad teeth. I want to look at a guy and they have nice teeth. Like, if you look after yourself, that means you're going to look after me. You know what I mean? You have a man and him fingernail him dirty and him toe them collect up all of the socks fuzz and him mouth and teeth. It just don't look like, you know. And the easiest way to see if somebody looks after themselves is to look at their mouth. Because I feel like sometimes people don't feel like you need to go for a cleaning every 6 months, or you know what I mean. My teeth aren't hurting me, so I don't need to go to the dentist. So you can see like the little fuzzies and stuff like that. And we're ending on time today because I'm taking my both kids to the dentist. So it's like panties. It's like panties. You don't really buy new panties every 3 months because nobody sees them. So like a ravel out panty, I joke and I'm like, oh, it's my favorite. You're not supposed to have your panties so long. You're not supposed to.
I just bought new panties from Amazon.
I saw, so I went and bought myself some too because I know you're going to style me.
But
so
you know what I bought from Amazon today, guys, too? I bought some, like, really sexy lingerie. Right? I'm blushing. So anyway, and then I bought some sexy lingerie, and then I was like, yo, this is so embarrassing because then you have to send that picture of what the item is, and then they have to, like, customs is going to open it. I'm so glad my name isn't on the packages. It's all Jodi's.
But I'm bringing some things. Nat Palmer is saying that's why a lot of the men them don't want to wear their mask because they can't start the smell of their own breath. Marks and Spencer's has the best panties. Send me some now. Oh, hot and sexy. You trying to give Stevie another sibling? Must see that? We do about to buy sexy lingerie.
Yes, sir. But anyway, and then, so I have so many flies in my apartment, like all the time. I guess it's because we cook so much at my apartment.
I think it's like fly season because usually I don't have flies in here because everywhere is meshed. But I do I found out like a few more flies within the past couple of weeks. Ever since I made that seafood.
How do you get rid of them?
You swat them.
I've been swatting them. Like a professional fly swatter now. I can flat swice.
You can what?
Huh?
What?
Shit, man, this Lady B has done it again. I just try to be like,
guys, we're in the fall flavors for Lady B Mixology. I'm having a caramel apple white Russian.
I'm having a peach coddler. CODD. I said it correctly, coddler. But this is
it's a cuddly heart.
It's sneaky. It is sneaky.
Flies are annoying, I know, and I just feel like as they pitch on the food, I'm like, ugh, gross.
Yeah, I wonder if my sweet girl went to sleep yet.
Who's sweet girl?
Probably take a nap too.
You look like you need a nap. I have to take my picnic them to the dentist. Use a blue light at night when you go to bed with no lights on.
Is that for the lingerie or the flies
or the sexy time? Hi, Strictly Cookies, we miss you.
Mama Usag, I'm gonna do that for both things.
Oh, thank you. My dress. Let me put a link in the description, guys. I'll be uploading this show pretty late onto YouTube. Just give me some time because I'm taking my 2 pickaninnies to the dentist, and then I have.
Me too.
Yes, they're both going to the dentist, and they don't mind it. So yeah. Oh my god, typing one. No worries. I'll put a link to the dress. I got it on Amazon. It's very comfy, very easy. I swooshed it at the side here. But anyway, guys, we want to thank you so much for being here. Let us remember that, you know, go and talk to one of your man friend them and talk about Prostate Cancer Awareness Month. That prevention is definitely better than cure. Talk to them about the blood test that they can get in case they're, you know, afraid of a finger up their butt. But really and truly,
this has got me.
Wow, okay, Trey is very happy here with the Lady B fall flavors. And then also we just kind of topped it off just to done in the diet with some ice cream, very creamy ice cream from Candy Craze.
We want to also remind you that Candy Craze has pre-packaged candy. So this is a cute ass little gummy bears. I think I'm going to keep this for Stevie. She likes gummies.
You can put them in her lunch pan or share one pack. There's a lot in here. So share it in half and send some for Remy and some for Stevie for the lunch pan. No Tricky's Corner. I don't think she's in any state to be doing a Tricky's Corner. Girl,
I'm not going to lie. I don't even know how
wow, Trey!
I don't even know how I'm going to drive home.
Are you serious?
I'm dead serious.
Good Lord, guys. Lady B Mixology is available at Jamaica Food, Drink and Kitchen. They're also available at Sovereign North Cannonball. They're available in Butcher's Block and the Commissary. You can check out their fall flavors. There's still more PTA meetings going on, so I'll be heading into my PTA meeting today with Shelly Ann just got me started on my wigs. I have a lot of wigs, and Shelly Ann's wig last week was so cute. I loved it. I thought it suited me so much. So I was like, let me back out our next blonde wig here. Yeah, this is a Cassandra. Yes. Alright everybody, thank you so much, and we will see you next week for another episode of Tuesdays with Tricky. Bye guys. Remember, check your body. Or check a friend's body. No, check your husband body, your boyfriend body. Check a body that is your body to check. Yeah.
Check a body.
Check a body. Check a body. Goodbye.